I'm Dr. Michael Baihari, and I have type 2 diabetes. You know, it's interesting, for years I cooked. My passion since I was a little boy is cooking, and I was always cooking all kinds of great dishes. I love to bake, sort of well known for my repertoire of cheesecakes. And after moving to our community, I wasn't feeling well, and I went to see my physician and described some of my symptoms, and he said to me, "It sounds like you have developed diabetes." After some testing, it was clear that I had, and then along with that, I also had high cholesterol and my blood pressure was up. As a physician, this was of great concern to me because I knew that diabetes, along with these other two conditions, were really risk factors for coronary heart disease. I knew a lot about diabetes, and in fact I had even written patient education materials about the condition, and I knew that the hallmark of treatment for it was diet and exercise. My physician, however, placed me on medications for the diabetes, oral medications, as well as medication to lower my cholesterol and to help me manage my high blood pressure. But I completely embraced the need to diet and exercise. I started to walk every day. I got a treadmill, and when the weather was not good, I walked on the treadmill, but as much as possible, I walked outside. I bought a pedometer and tried to do at least 10,000 steps a day, which is approximately 3 miles. And really actually enjoyed doing that. I walked in the morning and late in the afternoon. And I also, with my cooking skills, very quickly learned how to take some of my favorite recipes and cut down on the fat and cut down eating things like red meat, which I really love to eat, and embraced what is commonly known as a Mediterranean diet, which is very rich in fruits, vegetables, and grains, where most of the protein comes from fish such as salmon and occasional poultry. The diet and exercise worked wonderfully. My diabetes came under control. I was able to get off of all of my medications, and an added bonus was a weight loss of 40 pounds in less than a year. And in fact, my wife and I had to go shopping to buy all new clothes as my waist size dropped from a 40 down to a 34. Things went well for a while, but after a year, the diet and exercise became tedious. And I also started getting depressed because I understand that diabetes is not curable, and that even if I do everything I'm supposed to do, I'm still at higher risk for heart disease. To be honest, it's depressing. I became depressed, and with the depression, I started exercising less. And I started to go off my diet. And I started to gain weight again. I gained about half of my weight back. I needed to go back on all of my medications. It's an ongoing struggle. I'll exercise and eat properly for a while, lose a little weight, I feel better, tend to drift off again. One of the things that has helped is for me to share with other people the fact that I have diabetes and how I deal with it. That helps them, but it also helps me. I work as a writer. So one of the things I did was to write some health articles for the local newspaper and also write some articles for a newsletter that's distributed by our local Chamber of Commerce. And those articles were about how to eat healthy in local restaurants. I live in a resort town, and every restaurant tends to give huge portions of food, and it's difficult going out, but yet everybody wants to go out. And I have found it helpful to talk to people about diabetes, to write about it. It helps them, and it also helps me. I clearly have learned that making lifestyle modifications are really the best way for me to control my diabetes. It's clear that if I lost weight again, and if I exercise on a regular basis, I will be able to get off of my medications again and feel better and decrease the risks of some of the side effects. I know it's a lifetime commitment, and one of the things I've been doing, like my writing, is trying to find things to focus on that will help me be positive about the commitment. For me, one of those things is looking at a picture of my twin granddaughters who are now 2.5, and the notion that I want to see them grow up and go to school and go to college, and I can only do that if I make a commitment to taking care of my diabetes.